Major health concern: about 10% of Louisiana residents diagnosed with diabetes in 2010. And joining us now with more on this is Suzanne Howard, a registered nurse with People's Health. Welcome and good morning.
Well, thank you so much for having me. I'm so happy to be
Glad
here.
you can be here on this important topic. This is your specialty, right?
Actually, it is. I'm a certified diabetes educator and a registered nurse for People's Health, and I work in the chronic care department. So diabetes is a huge, huge issue here in southern Louisiana, and the whole entire nation.
When you say it's a big issue, first of all, what exactly are the symptoms of diabetes, and why is it such a big issue for us?
Starting out, let me explain about diabetes. Diabetes is a disorder that is where our body cannot properly use insulin, or we're insulin resistant. And there's three types of diabetes. You have type 1 diabetes, that is an autoimmune disorder that you cannot prevent. I mean, you're born with it and you're on insulin for the rest of your life. Type 2 diabetes happens gradually, usually in the adult stages, but now because of the disease progression and obesity and so many other factors, even children are starting to get type 2 diabetes. And that is controlled with lifestyle modifications is the huge thing, and oral medications, and then sometimes with insulin. And then you have gestational diabetes that can happen. It usually is diagnosed halfway during your pregnancy.
And when you look at our particular area, what are the factors, do you think, that contribute to it being so high here?
It's very, very high here in New Orleans and southern Louisiana, and also with the southern states. I think our lifestyle, lack of activity, our obesity rate, our ethnic, the ethnic diversity here, and the food that we eat. You know, New Orleans has wonderful, wonderful food, but it's all about fat, sugar, fried, and salt. And all of these things together, and it's not just one thing, it's just the whole conglomeration of all these things together. People start having a lot of symptoms, and diabetes goes undiagnosed for probably 5 to 8 years before you actually are diagnosed with diabetes. So
we have some symptoms that are out there. Are these the things that you should, pay attention to if you have this?
Yes. Increased thirst, increased urination, slow healing wounds. You can have mildly high blood pressure, high lipids, which is your cholesterol, fatigue, blurred vision, all of these things together. And there's so many things to look for. And the main thing is to go and get your screenings done at your doctor's office. That is huge.
And tell me how People's Health, the role and what you're trying to do, and how people can learn more about this.
We have our members for People's Health. We have so many screenings and events that are set up throughout the year. And we try to educate the members in the population of People's Health about how important it is to go to your doctor, to have a very good working relationship with your primary care physician, to get your screenings done, to get your blood work done, to talk to your doctor openly about what's going on. And we have a seminar that's going to be at UNO on the 24th, and where we'll have one of our diabetes doctors or providers, and they'll be talking about ways to prevent diabetes.
Okay, so if you show up at noon at the UNO Lindy C. Boggs International Conference Center on the 24th, you can get some more information.
Correct. And this is free to the public, and you don't have to, there's no charge, and we invite the community to come in.
Well, it's an important topic since so many people here are impacted by this, so thank you so much. And this should be an important thing to check out if you have any concerns about yourself or your loved ones.
Yes, absolutely.
Thank you so much for coming in.
Thank you.
Have a great weekend.
Thank you.